Blake's Take It here. Today we're going to talk about what we do for sprains, strains in the low back. Now we treat the low back much like we would any other joint in the body. So you have a sprain, strain, which can be caused from you sleep wrong, you get up and you tweak it, or you lift something too heavy. What happens is the tissues are injured, so you need to manage the inflammation of the injury as well as you need to manage how the tissues heal. So let's say we take an ankle, for example. When you sprain your ankle, the first things you want to do is you want to just do like a real pain-free range of motion, and that helps to make sure the tissues heal in the proper pattern to help with the gravity bearing of the joint itself, and B, it helps to clear out the inflammation. The low back is no different. So what we use in our office, we use the reverse hyper here by Westside-Medical. The first step we have with our patients is we want to just do like a small, maybe 10, 20 degree range of motion just to start the clearance of the inflammation as well as make sure the tissues are healing in the proper pattern. So we have the patient step up, and we have them place their whole pelvis on top of the table here itself. And so we just make sure when they lower the legs all the way down, make sure there's no pain there, and just have them to simply lift it up, just like this. And that's going to help to traction the tissues so the scar tissue or the healing tissue gets laid properly. Then when you bring it up, it helps kind of compress the inflammation out. So that's the very first step. A lot of times on the second visit, we'll increase the range of motion more, so probably put about half the pelvis on the table here itself. So have them lower the legs down. That's probably about 30 degree range of motion. And once again, just do the same thing. Just help clear the inflammation. And eventually we want to get them to where they have full range of motion. About 9 degrees, full range of motion right through here. We probably set the range probably about 2 to 3 sets of 10 reps. And then once they're able to do a body weight, then we start transitioning into the weight-bearing phase of the rehab, or the resistance phase of the rehab here. So we put the strap across their feet. And once again, we go through this full range of motion. What's nice is this takes you through the full treatment process, just from like the small range of motion all the way to the weighted resistance. So that's what we do in our office here. Hopefully that helps you guys out some.